Greetings. Thank you all for being here today. My name is Wendy Goldberg, and I am the Executive Director of the Tri-Faith Initiative. I'm so grateful that you all have taken time out of your day to join us. And I will begin with a brief invocation. May we be heartfelt in ways we show support for all in need of care and healing. And may we find strength for all who need comfort. For those who are particularly vulnerable, may we be safe and protected. May you know that you are not alone. If you are experiencing fear or anxiety, we stand here with you. For those who are facing difficult decisions between food on the table and public safety, we vow to stand for policies that recognize your plight. For those who are inequitably impacted by this virus, we see you. We value the dignity of all humanity and work for shared solidarity. For public officials and decision makers, we pray for wisdom and guidance. For everyone on today's call, thank you for all you do to nurture spiritual wellness in Omaha. May you feel the comfort and support of our collective so that together we can build a better and more just and safer world. COVID-19 has taken a spiritual toll on our community as we struggle to stay connected, mourn the loss of loved ones, and navigate economic uncertainty. Opening lines of communication with Omaha's faith community and in collaboration with local officials will ensure that faith leaders and institutions have an evidence-based plan to begin the process of re-engaging congregants to safely return to in-person worship, services, and meetings. I'd like to give you an outline of today's agenda. We'll begin with an overview of the latest information from our city officials, then listen to 3 firsthand accounts of experiences of local congregations, and then we'll have a panel with questions and answers with Dr. Poor, Mayor Stothert, and Dr. Kahn. I invite you to use the chat during this conversation and the presentations to pose questions and share your ideas, and we'll pull from the chat for the panel discussion. To maximize the potential for our technology success, we ask that you keep muted unless you are currently speaking. And if you have any challenges with technology, please send a direct message to Tri-Faith, which is one of the co-hosts. It's our Deputy Director, Eric Servione, who was helping us behind the scenes, making sure that this all runs smoothly. To get started this morning, I would like to invite Dr. Poor, the Health Director for Douglas County Health Department, to give us an update on the current situation. Welcome.
Welcome, everybody. And this is really a treat to be on here. And I can't tell you how much I need your spiritual guidance in everyday's life. So thank you for all you do. And praying for me, because this is not an easy time. But I want to give you just a short update what we are seeing in regards to cases in our community. So as of this morning, we have 2,570 cases with COVID-19. Compared to the state of Nebraska, that's potentially 24% of what the state of Nebraska has. We are still seeing that individuals are mainly 51% of our cases are in the 25 to 49-year-old range. And that is good because we know those individuals are potentially the strongest for the infection to heal with the infection. They also potentially have milder symptoms, and that is helpful. We are seeing, as I have talked about over the last 2 weeks, potentially, we are seeing a disproportionate effect on our minority community. And that's really, I think, where we all just really need to engage as a community. This virus does not distinguish what is your race and ethnicity, doesn't distinguish even on your political guidance or so on. It only, if the virus finds you, it has a potential to infect you. And what the virus really is showing us now is that there are individuals, there are community members who are working in certain sectors of our workforce and are therefore more infected by the virus. So 48% of our cases are out in our Hispanic community, 15% in our Asian community, and 10% in our African American community. Over the last 3 weeks, we saw the highest number of cases that we have seen since the pandemic started. But we also have seen the highest number of testing that has been done during these 3 weeks. So let me talk a little bit about how many tests have we done in our community. We have done more than 18,000 tests in our community. That's approximately 3% of the Douglas County population. Compared to Nebraska, the state has done 72,000 tests. We have done in our community 25% of the total testing that has been done. Our positivity rate last week was 11.6%, and that compares to the week before of 22%. We double our case rate in 10.8 days at now. So the doubling rate, and you hear that measure often on the national data, our doubling rate is 10.8%. We have testing going on in various avenues, and you know that you can get testing if you are symptomatic. Call your healthcare provider, call your hospital system, and so on, and hopefully you can get a test done. But we also have other initiatives in our community. One of them is Test Nebraska. You have heard the governor probably talk about Test Nebraska. It's an initiative that that the government is paying for it. We have had a site of Test Nebraska in Douglas County since the beginning, which was potentially the 12th of May at the CHI Center in downtown. Maybe something that I may want to talk to you about if any of you would be interested, because now we are starting to look about moving that potential site to other areas in our community, because we are promised by the governor that Test Nebraska will stay in Douglas County for the time being. We have done through Test Nebraska 2,475 tests, and we have had positive cases of 57, which brings us to a positivity rate through Test Nebraska of 2.3%. We have another initiative going on, and that is through the National Guard. We have heard very clearly from One World Community Health Center that they are overwhelmed and they need more testing in South Omaha, specifically because many of the members in South Omaha work also in the packing industry. So we have started the testing. The first day was last Thursday. They've tested 206 individuals, and we have gotten 40 tests back positive from those 206, meaning a positivity rate of 20%. So we had Test Nebraska at 2.3%, National Guard at 20%. What that indicates is that we are testing the individuals who really need to be tested, and because then we can isolate them and we can follow up on those individuals. We have done testing at the National Guard, with the National Guard on Sunday. We did 300 tests. On Monday we did 300. Tuesday we then decreased. They were decreasing to 207. That testing is supposed to go on actually for 2 weeks. That's for as long as we have a commitment that that will be going on. We have also provided tests to Charles True and to One World. So with a broader criteria, because all of the testing that is being done through private healthcare provider and through the hospital has very strict criteria still at this time. You need to be symptomatic, you need to belong to the healthcare workforce, and so on. So what we have said to Charles True and One World, please test more. Let test people with underlying comorbidities and so on. I also want to tell you there are 2 CHI clinics that really have been helpful in our community, and that is a CHI clinic on 132nd approximately and Center that has been really well, where we could have sent people to that needed a test and called us, and we had done a quick assessment with them. Also CHI at Cumming Street, and that is behind the Creighton campus there. They have been fabulous. And we are in discussion with Nebraska Medicine at this time to see if they would actually be willing to do some more community testing. We are looking for a proposal from them coming on. We have done some special testing at our 2 shelters because we have had outbreaks in these 2 shelters. And shelters are specific because they have a population that comes in and out of those shelters. Some of the shelter people actually work and come back at night to the shelters. So for shelter directors to really try to isolate and try to arrange their spaces, it is necessary for them to know who is positive and who potentially do we then need to cohort together. So we have done 2 rounds with the shelter. That is best practice nationwide, that you test and then 7 to 10 days later you come back and you test again those that were negative the first day. Because we do know that when you are negative the first time, you actually could be positive a day or 2 or 3 afterwards. And so that has been doing well in the shelters, and we are happy about that. A project I want to share with you very quickly is that the governor has put in place with HHS very early on is called the Accommodation Project. It has 3 parts in it. One part is that there are contracts with hotels in Douglas County. So emergency responders, healthcare workers, long-term care workers, and correction facility workers that go to work there but do not feel they want to go home at night and bring potentially the virus back home or bring it back from home to work the next day. They can actually stay in these hotels and go back and work from home. That has worked very well. We have quite a few people who are using these resources. And now what has happened to the decision has been made that these hotels, a hotel should be set aside also for individuals, employees who work in meatpacking industries, so that they have the same opportunities to use these hotels and not have to go home to their families. At the third arm is that UNO dormitories have been set up for the general population. If somebody needs to be quarantined and they feel that they have, for example, vulnerable individuals at home and they don't want to go home and stay home for those 14 days of quarantine, they can choose to be quarantined at UNO dormitories. That means, however, in those dormitories, different from the hotels, they cannot leave the dormitories within those 14 days that they are going to be in there for quarantine. The other thing I do want to mention, and you probably have heard me talk about this, our food production, 50% of our cases are in the food production industry at this time. 7% are in our long-term care facilities. We, however, have a resource in our community, and that is ICAP, the Infection Control Assessment Program that is at Nebraska Medicine. That is made up of infectious disease docs that specialize in infectious disease in regards to long-term care facilities. These teams will go in long-term care facilities, assess protocols, look at the environmental assessment of that facility, look at how are these communities, these facilities set up in regards to masking, in regards to spaces for quarantine and isolation. They make recommendation to these facilities and to make sure that they not have transmission. And they actually make recommendation, if it is recommended that these facilities should test everyone in their facility, or if it is better to isolate certain individuals and only test around those individuals. The same group or the same teams actually also go to meatpacking facilities and also look at those meatpacking facilities to do assessments of them. What needs to be done in it? Is it in regards to masking? Meatpacking, we know often these individuals are very close together when they share their workspace. So they are talking about dividers. So they are talking about not sharing a lunchroom together, really trying to do social distancing. So it is a wonderful resource that we have in our community, ICAP. Let me just share with you a little bit about the most uncomfortable and saddened thing that we always need to talk about, and that is individuals who die from COVID-19. We have in our community 24 individuals that have died, which means from the total cases that have died in Nebraska, 18% of them are from Douglas County. When we are looking at the age range, as you can expect, 74% are older than 65 years of age. We have 16% who are in the 50 to 64 year range, and 10% of those deaths are 25 to 49 years of age. When we are looking at the race and ethnicity, 68% of those deaths are in our Caucasian population. 21% are in our African Americans, and 10% are in our Hispanic. Looking at comorbidities, what does that look like? 42%, and definitely the highest comorbidity are respiratory illnesses. Underlying respiratory diseases, that could be asthma, is one of the prior ones. The second comorbidity is renal diseases. And 1 out of every 4 has diabetes as an underlying health condition. What is surprising to me, and maybe to you too, immune suppressed diseases are only 10% of those deaths have underlying immunological diseases, and only 10% of the deaths are having cancer as an underlying comorbidity. So the last thing, well, 2 things. I want to say something positive, and that is 471 of our cases have recovered. That is, we have staff specifically designated who calls up individuals about 3 weeks after they have been diagnosed with a COVID case, and is trying to determine, have all the symptoms, have individuals recovered fully from the symptoms? And if they have, they are a recovered case. If they are not, they are, some people more than you would expect are saying, even after 3 weeks, they're saying, there are still some things that we are not fully recovered. So they would not fall into that category at this time. When we look at the age ranges of those recovered, 58%, or the highest percentage, is into 25 to 49 years old. And that would really be what we would expect. Only 9% of those are 65 years of age or older. When we are looking at the race, 40% are in Caucasians, 36% in our Hispanic population, and 15% of those who are recovered are African American, and 7.1% are Asians.
Dr. Poor.
Yes.
Thank you so much.
Thank you.
I want to make sure that you take maybe a last minute to kind of finish up so that we can hear from the mayor.
I only have 3 more measures that I want to talk to you. So I'm glad. I'm sorry. I have a lot of data, and I didn't know how much time I had. So just in regards to hospital capacity, what are we seeing there? Because you heard the governor talk about it is really important that we are not overwhelming the hospital system. So we are now at an occupancy rate of 69% in our hospital beds in our community. That is concerning because we have seen that hospital beds are being used more so that we have elective surgeries going on. We have now 137 COVID patients that are in our hospital beds compared to 2 weeks ago where we had only 74 patients. In regards to ventilators, and I stop, that is good news. We have only 122 ventilators used at this time. We have a total of 374 ventilators in our community. So 250 ventilators are not in use at this time. So a good news for our community as a whole. And I stop at this time. So thank you.
Thank you so much. We know how many hours and long days that you're putting in, and we are very grateful for your service. Thank you.
Thank you.
I'd like us next to turn to our mayor and invite you, Mayor Stothert, to tell us about how the city is responding in light of the virus. You need to unmute.
Okay, can you hear me?
Yes.
All right, good afternoon, everybody. Thanks for inviting me to be here today with Dr. Poor. And you know, I want to reemphasize what Dr. Poor just said earlier at the beginning, and that your prayers are needed and appreciated. This is just such an unprecedented time for all of us. We've never dealt with this before. And I will tell you, I talk to Dr. Poor multiple times every day. The decisions we make are very hard, and we consult with each other a lot, as well as the state, before we make decisions. And I will tell you, my experience since about March 1st with Dr. Poor is you could not be in better hands. So we are really fortunate to have her as our public health director in Douglas County. But keep those prayers going, because boy, I tell you, there's still a rocky road ahead. So let me tell you, I'm going to give you a little mini state of the city, just to kind of let you know where we are and what's going on, because it's unbelievable. But 2020 was going to be and was heading to be one of our best years financially that the city of Omaha has ever had. We were in such good shape, and then COVID came and everything just stopped in its tracks. And our whole goal along this whole time was to protect our citizens and prevent the spread of the disease. But we have all been hit very, very hard with this and the decisions that we have made. And so I want to let you know, with the city, my goal is to keep every city employee employed. Of my 2,700 city employees, over around 1,600 of those are firemen and policemen. So that's really important to know that we are doing, my decisions are made based on doing everything we can to continue to provide the citizens of Omaha with the best city services we still can during this very, very uncertain time that we have now. Going back a little bit, because of all of the events that were closed and canceled that we were scheduled to have this summer and this spring, the city of Omaha has taken a very, very hard financial hit. And I'm going to explain the reason why. About 50% of our general fund budget, which is the budget that funds all city departments, comes from sales tax and occupation taxes. Only about 23% of our budget comes from property taxes. You take Douglas County as a whole as an example, almost all of their budget is based on property taxes. So they haven't had a financial hit like the city of Omaha has. And we have determined that because of things like the College World Series, the NCAA basketball, Berkshire Hathaway, we will take the USA swim trials. Along with that, our hotels have shut down on their own. We didn't ask them to, but we get a hotel motel tax. The restaurants shut down, we get a restaurant tax. So you add all of those things together, and we think that in our general fund alone, we have about an $80 million hit with our revenue that we were expecting to have this year. $80 million. Our all fund budget, which includes some federal dollars and bond dollars, it's about $127 million hit. So I have to figure out how to navigate through this loss of revenue and at the same time continue to provide those really good city services that is why we exist. You know, we have to continue to have a fire and a police department. We have to continue to plow the streets and keep the street lights on and pick up your trash and keep the parks in good shape. So we are really looking at slimming everything down we possibly can without affecting those important services, essential city services. And it's not going to be easy. Some of the decisions that we've made have been very, very difficult. So let me just tell you a little bit about that. The CARES Act that was approved by the federal government, we're still trying to figure out all the guidelines for it. But what it had is that any city or county that had a population of 500,000 or more automatically got an amount of money deposited into their account based on that population. Omaha's population is right under 500,000, and you had to be 500,000 or more, the city or the county. There is only 37 cities in the entire country that are over 500,000 that qualified for that direct deposit. In Nebraska, no city qualified for the direct deposit, and only one county, Douglas, qualified because their population with Omaha in it is right over 500,000. If you took Omaha out, Douglas County would be about actually about 80,000. So Douglas County received that money just because of the population, and it was because the city of Omaha was part of it. The state, consequently, was given two options. Every state in the United States was given two options. They could take money from the federal government CARES Act based on their population, or they could get a lump sum no less than $1.25 billion. So the state of Nebraska opted for the $1.25 billion. So that was not based on population. It was basically a lump sum that was the minimum amount the states can have. With that CARES Act money, though, right now, presently, and it seems like it changes all the time, and I have to say, Congressman Don Bacon has been our real champion trying to get Omaha and Douglas County some help, is that it doesn't apply, or it cannot be used for loss of revenue, COVID-related loss of revenue. So that $80 million I just told you about, a loss of revenue because of all these canceled events, the CARES Act money cannot be used to replace that. It can only be used to replace COVID-related expenses that occurred because of COVID, not because of revenue loss. So we are still trying to navigate through how we will fill that gap of the $80 million shortfall. But with the COVID-related expenses that we have determined based on all the criteria we've received from the U.S. Department of the Treasury, we have calculated that we have about 71 million in COVID-related expenses. Now, that may seem like a lot, but what has been more and more clear is this is not just things like PPE and overtime. It's things like any city employee that is now doing work that they normally weren't assigned to do because of COVID, those salaries could be covered. For example, recently, Secretary Mnuchin said just last Thursday that because of loss of revenue, to prevent fire and police departments from having layoffs because of that loss of revenue, that this CARES Act money could cover all of their salary that was given to them from March 1st through the end of May. So it's becoming clearer and clearer how that money can be used. But the bottom line is this, is we have to have an agreement with Douglas County. Douglas County has to agree to fund the city of Omaha, all or some or part of these COVID-related expenses we have. And that's one thing we are working on right now with Douglas County. I've also asked the state, the governor, that if he would help some of Omaha's COVID-related expenses out too. And they have agreed. To what extent, I don't know yet, but we will have an agreement with the state too. But when you add up the $80 million shortfall in revenue and then 71 million in COVID-related expenses, you could see that this is a very challenging time for me, who the mayor is in charge of, responsible for the city budget. Our city budget is approved by the city council in August every year. It goes into effect January 1st the next year. It has to be balanced to the penny. It's up to me to make sure that that budget stays balanced throughout the year and that I balance it out by the end of the year. So I have a very short period of time with some real unexpected shortfalls and expenses to balance that city budget out. So we need to be making very, very wise decisions, and some of them are very, very difficult. I will let you know right now some of the things that I have already done to reduce expenses, because I think it's important, is we have imposed a general hiring freeze. We're not hiring anybody right now, including police and fire. We have a spending freeze. We ask all city departments to reduce their budgets as much as they could. We got about $5 million of individual departments together of decreasing spending. We have some other savings that, like, we aren't going to buy any more police cars this year. We have some healthcare savings, so those add in there. We've changed to all of our part-time staff that we have tried to reassign at first, but now we're trying to really save dollars. So our part-time staff has been sent home right now without any hours. When you, and to understand the magnitude of this, at this time every year, we are hiring a lot more part-time people. And we're hiring hundreds of lifeguards, for example, for our pools and for our community centers and from a lot of the activities we do during the summer. And if we calculate what extent all those part-time people that we're not hiring now, it's about 800 part-time people that we have either sent home without hours assigned, and so no revenue or no salary, or the ones that we haven't hired. It's about 800 part-time people. So it's affected about 800 different people, just what we are trying to do right now to reduce expenses. But my goal is to not have to do anything as far as furloughs or layoffs to my full-time staff. We've unfortunately had to cancel a lot of things, like our summer camps that we do. Hummel Summer Camp has been so popular in Omaha for years. We canceled that not only to save money, but because we are still under the directive healthcare measure from the state that says no more than 10 people in an outdoor gathering at a time. And you can't have a summer camp with a lot of kids, hundreds of kids at a time, and have only 10 at a time. So we had to cancel
Mayor?
our summer camps. Yes?
So we have about a minute or two. I want to make sure we have time for conversations with the faith community. So if we could wrap up in a minute or two, that'd be grand. Thanks.
Other things we've done is we've we've closed libraries. We've closed our community centers. We have talked about no callback and overtime for our police and fire department. Neighborhood grants that I usually give out, we're not doing. I'm just giving you an example so you all understand what we are dealing with as far as the financial implications of what COVID has done to the city and how difficult it is right now to navigate through this and make the right decisions so that we can continue providing essential city services. So it's a very unique time. It's a very challenging time. And one thing Audie Poor always says, and I'll repeat it to you all, is there will be an end to this. We know that. Every pandemic that has ever hit the world, there has been an end. People have recovered. We will recover too, but we really need each other to do that. And so we will just work towards that time that we are in the recovery stage, which hopefully we will be soon. And it may take 6 months, it may take 2 years, but we know we will get out of this, and we know we will all get better, hopefully, because of it.
Thank you. So I have invited members of a few different congregations to share the hard decisions that they are making as well, so that we can start to get a feeling for what the congregational response and the faith community response has been to our shared hardship. So first, if we could hear from Reverend Scott Hastings from the Catholic Diocese, if you could give us a minute or so of a briefing on how the Catholic Diocese is addressing the virus.
Certainly. Thanks, Wendy. We have 53 parishes in the Omaha metro area, and they're of a variety of sizes. So when we got the go-ahead to open up liturgical services, we did that. And about half of our communities decided to open up. We left that discretion to pastors and their parish leaders. So right now, about half of them remain open. Our experience is that the larger the community, the harder the logistics. So communities of 10,000 people plus really found that they just couldn't manage those logistics in a short amount of time. Smaller communities found that more manageable. So I'd say that's the first thing. The bigger the community, the more the logistical challenge. Although I think they've met it positively and they're happy to get back together. The second thing I'd say is we have a very large Latino population, and that community is dramatically afraid right now. So afraid both because of the rate of infection and there's a fair amount of uncertainty about the future, and communication in that community is somewhat difficult. So again, we're approaching that with positivity, and we think we have some good inroads moving forward, but there's just a lot of uncertainty there. The last thing I'd say is that we're all kind of wondering what happens after July 1st when the federal funding goes. For everybody, what are the material needs that are going to be coming? So in conversation with a wide variety of agencies, the Archdiocese is not the same as Catholic Charities or the St. Vincent de Paul Society, but in conversation with those agencies, we're trying to just figure out what's coming. So finally, I just say that we're very happy to be together, even though we can't be together the way that we have been. We're very happy to be. And the long history of faith is that oftentimes people are persecuting us. And all of our traditions have that experience. But right now, nobody's persecuting us. So all we have to do is find a way to be creative in the circumstances that are in front of us.
Thank you very much. I'd now like to invite Aaron Evans and/or Josh Perez to share how the Church of Latter-day Saints in Omaha Stake has been addressing the situation.
Wendy, thank you for the opportunity. Josh Perks, I'm the president of the Omaha, Nebraska Stake here in Omaha, which is one of 4 stakes. Each stake has about 9 congregations, and so we have just about 30 congregations in the Omaha area. We, so several years ago, we actually started an initiative called Home-Centered Church Supported. And so we created a lot of curriculum that families could do together and study the gospel and do that at home. And so when COVID hit, we actually canceled all church meetings worldwide. And it was really pretty amazing to see that home-centered church-supported program continue pretty seamlessly. It actually was quite miraculous. We have in our congregations, many of our even youth that are 16 or older have the ability to participate in the sacrament each week. And so they were invited to administer the sacrament in their own homes. And those were really amazing and tender experience to sit with a family and have the sacrament. Some that don't have that ability, we're asked to try to administer the sacrament to them at least once a month, and particularly paying attention to some of our elderly members, but doing that, of course, safely. We've also had a lot of use of Zoom. Our youth get together and do Zoom meetings, socially distanced, virtually, with lots of different activities, and that's been really helpful. And then we've just been trying to be as mindful as we can of the welfare needs. We have lots of self-reliance initiatives to help with those that need help with career or professional help. We're trying to pay attention to that right now, particularly with all that's going on. As we come back, our church yesterday issued some guidance on coming back, and we're really staying close to local and state guidance on how that would work. But we see it kind of coming in phases. Just as Reverend Hastings talked about, some of our smaller congregations where they have less than 100 people and can socially distance in the congregation, we'll probably do some smaller meetings. Some of our larger congregations, we're going to probably have to shift and have maybe half the congregation come one week and the other half come a second week. We probably won't participate in some of our primary or children activities just because of the risk for a little while. Hand sanitizer, all the other great things that many of you are doing, but we're trying to be extra cautious as we go into this. But just appreciate the support we've had from our fellow faith leaders and community leaders.
Thank you. Next, I'm going to ask Rabbi Brian Stoller, who is a Tri-Faith Initiative board member and the senior rabbi at Temple Israel, to tell about how each of the congregations on the Tri-Faith Commons is addressing their response.
Thank you, Wendy. So I see that my colleagues from the Tri-Faith Initiative are here as well, so they don't mind me speaking for them. We in the Tri-Faith Initiative have taken a careful and cautious approach in respect to our operations during this time, and each of us is in slightly a different situation. For the Muslim community, it's been the holy month of Ramadan, which is just coming to an end this weekend, and so our Muslim congregation, the American Muslim Institute, has opened for 3 services per day with very tight limitations on the number of people who can be in attendance and a number of other restrictions to ensure as best as possible the safety and the health of the people who come. For the synagogue and Countryside Community Church, our national umbrella organizations have recommended caution for us and encouraged us to remain closed and in virtual operations for worship services for the time being, which both Temple Israel and Countryside Community Church are doing. We have virtual worship each week. Our synagogue and church buildings are closed to the congregations and to the public, but that said, there's a great deal of energy and vibrancy happening outside of the walls on Zoom and in other forums. In fact, I know a lot of clergy colleagues are experiencing this around the country, that engagement of our membership is in many ways up significantly. So we feel very good about how we're serving our communities and keeping people connected during this very challenging time.
Thank you, Rabbi. I next will invite the chair of the Tri-Faith Board, who coincidentally happens to be the Dean of Public Health at UNMC. It's a timely piece for us to have such a resource here in Omaha. So Dr. Ali Khan, I'd like to give you the opportunity to share any reflections that you have in terms of best case practice and how we might think about moving forward. And then a few questions are starting to pop into the chat, and we'll pose those to our panelists in the time that's left.
Thank you, Wendy, and thank you to everybody. Thank you all for tending to the spiritual needs of our community. I think that was articulated very nicely by Dr. Adipur and the governor. We need it more now than ever, and thank you for the faith leaders who started us off. So I must say, of all of the businesses that are opening up, the faith community has turned out to be the most controversial in many ways, and has been handled differently by local leaders across the United States. So some have been opening up in phase 1, and some actually, if you go to California, have been delegated to phase 3 of opening up. And then regardless of the phase that they've been opening up, many of these, many faith leaders have made their own decision of when they open up. And I think Reverend Hastings made that point, that many of his churches made their own decision of whether or not they're going to open up or not open up. So it's been extremely variable. And I think that variability reflects what we saw as this outbreak pandemic unfolded, that many of these congregational settings were the source of mass gathering events, and we saw a dissemination of disease through these worship lanes and out into the community as a function of churches. And I think people are very conscious of trying to make sure that they protect their worshipers and protect others within their community as they now go back and open up again. And so it's nice to see this focus on making sure that we open up, but we open up very safely at this point, and that caution is obviously needed. I just saw something before I got online now of, I guess, a church in Florida and a church in Texas, where they had opened up and they had recently had to close because there were 2 outbreaks associated with those events. So this is a very opportune time. So thank you Wendy very much for bringing this group together to have this conversation about how we can open safely. And I would like to welcome everybody on this conference call and other faith leaders within our community. Tri-Faith has decided to set up a group, and we would invite you to join that group to think about what guidelines could look like for our community, to help them to think about how they open up through these various phases. And we would look to Dr. Adipur to help advise us on her suggestions of whether or not we are in a state of substantial, moderate, or low transmission within our communities, and what that means in terms of when we can sort of phase through eventually allowing, for example, more congregants, or allowing vulnerable people back out into our faith gatherings. So we'll look to advice from Dr. Poor and others within our community on the best time to do that. But again, I'd invite anybody interested to please send an email to Wendy and say you'd like to join with us to think about putting together some guidelines that we could all use as we are tackling this common issue of how do we open up, how do we re-engage our community, but how do we do that safely and bring everybody back. So I think I'll stop there, and Wendy, turn back to you and the other 3 people on the panel to take questions.
Well,
Go ahead, Wendy.
I'll ask you to go a little bit further with one of the questions that you started to touch on. Laura Mitchell asked, what criteria is everyone using to determine when to resume in-person worship? From your perspective and or Dr. Poor, I know you've said a lot of data, but if there are 1 or 2 benchmarks that we should be watching for in these reports, what are they?
So Dr. Poor, do you want to start off on how you're thinking about phases within our community and vulnerable populations, or you're muted?
I unmuted.
Glad to take a stab, and then Dr. Khan, I would expect you to jump in. So I would say one thing, I'm starting the phase 3. Vulnerable populations probably would belong into phase 3. So when you are starting to talk about opening up and so on, so that's one of the parameters I would use. But in regards to when is there a good time, it all depends on your church a little bit, and how are you able to do social distancing in your spiritual environment. And I think you can look at some of the benchmarks that come out of the Global Center for Health Security. Some of those benchmarks are number of new cases per day. They are the percent positivity rate. They are the number of deaths that we see in our community. So those are the 3 benchmarks that are easily, we have a pretty robust dashboard on our website that people can go and look on. But I would say those 3 benchmarks are in my mind, are really important ones. I'm interested to see what Dr. Khan wants to add to it. Dr. Khan?
So if you go to, and I have to give credit to Dr. Adipur, because if you go to her dashboard, you notice it's one of the few dashboards where you actually see the ethnic breakdown. So she not only talks about disparities, she actually, they talk about walking the talk. So she actually shows the data, so you actually can see it. So she's championed that for a very long time. And you're very fortunate to actually have one of the best local public health directors in America. So if you look at the data in Douglas County, you've only peaked probably 2 days ago, right? So you're only now starting to see a decrease in cases. And it would be, in my estimation, it would be very early to talk about trying to allow people to go back into their faith communities at this point. So if you do choose to allow people to go back into your faith, well, number one, vulnerable populations are a long way away. Let's just admit that right away. So if you do choose to allow people back into your faith communities, absolutely, we need to be talking about what are the environmental controls in your buildings to decrease transmission, what are the administrative controls that you've put in place to protect the people who work in these buildings, and then to protect the people who come into the buildings, including what measures they take around face masks and social distancing and hand washing. So it's a combination of multiple concentric layers of protection to make sure that everybody stays protected. But I think you heard a lot of good models there. Rabbi Stoller talking about how they're continuing to rely on Zoom for now to a strong extent to continue to engage their communities as much as possible until we really do see some sustained decrease in transmission within our communities.
So several people are asking specific question about children and childcare, and whether if they're not able to hold social distancing in person without some level of children's services or daycare, what suggestions, what measures do you suggest, and at what point would you consider inviting children back in to the congregational setting?
Well, I can talk from the direct health measures that are now in place. You know, they are 15 children in a room by itself. That does not include staff. So as long as you can keep it in small rooms like that, then that is appropriate. Now, the thought is starting June 1, should we need to increase that number? So potentially you may see some changes coming. We have not decided on what that number will be at this time, but that's what I would say at this time. If you can keep it in small groups, then you are fine, but it's 15 at this time.
The next question that has come up from multiple people has to do with the Hispanic community and in general, addressing communities who may not have the language support to understand that, and they're suggesting that the information is available in Spanish on the website, but there's a problem for a lot of Latinos not being computer users, and how to spread the word to solve this issue, and how should the pastors in those communities or who serve those communities help to serve as a liaison to get the message out.
If I can just start, Wendy, that's really where I need your help and assistance, because you are the trusted source in the community. You have the spiritual well-being of your community in your hands, and they trust you. And so I expect, or I would hope, that you can be that information source for these individuals. You are absolutely right. There are so many languages that are being spoken in our community. There is just no way that from a health department standpoint that we could provide that information in all those communities. We are trying to do with contact tracing, because from our standpoint, that is a function that the Douglas County Health Department has. We have interpreters, we have Spanish-speaking people, and we are using a language line that has worked pretty well, but we need all our help. This is our community, and we need to put our arms around our community.
So the next phase of that would be to be able to advocate for the needs and the dangers in the workplace related to those particular communities. Are there suggestions that you have for the faith community leaders to stand together to address some of those practices that are happening, that balance between human life and the economy?
I would really like to see some of the faith community be strong and communicate together and advocating together for the community. So I would think that would be really something that I would be looking forward. I don't need to be the public face all the time. I would love to see you as a faith community come together and communicate to the community as a whole.
Thank you. Let's see here. Kathy Gurking is asking, how might we interpret the statistics caused by exposure on the dashboard? Could we interpret that when community is trending down and direct contact is going up, it might be safer to gather, still observing physical distancing, sanitizing, and face masks?
That's a very good interpretation, and that is why we put that exposure tabule on there. Yes, you can determine then where the potential exposure has occurred. You know, if you think back 2 months ago, we started to put direct health measures in place when we saw the second community spread. In the beginning, it was always travelers who came into this community, and we said, you know, it's being brought into the community. The moment the first individual was identified where we couldn't find a cause, the person said, I didn't travel, I don't have any, I don't know where I was exposed. We said, it is in our community, and then we need to take special precaution. So that interpretation is very good.
Thank you. And if there has been an exposure, this question is from Aaron Evans. If a congregation practices social distancing, what recommendations for quarantine should we give congregants if a participant is diagnosed with COVID days after a meeting in person?
So it always depends on what how close that contact has been. So let's say you have an individual who has been identified as being COVID positive. Hopefully that individual can tell us where they have been sitting in church or in a temple or any type of worship. And we then can say individuals who have been within 6 feet, hopefully nobody, but have been within 6 feet of that individual and longer than 10 minutes. Not just walking by, but in contact with that individual. Those individuals should quarantine themselves for 14 days because they are potentially at high risk of being exposed. Usually that is household members, and that's why we make that distinction that household from household should be 6 feet apart so that we are not having this transmission going on in worship houses.
So there's also a question here about the use of bathrooms and air conditionings or airflow being in buildings. Any suggestions about language that the spiritual leaders could use related to those questions about gathering or the safety of that as they address the needs of those who are looking to gather more quickly than perhaps the guidelines suggest?
I'm going to give that question to Dr. Khan.
You're going to give, thank you, Dr. Poor. Very kind of you. So for those who are looking to gather more quickly than what the guidelines suggest, I'd like to remind them that the virus has not gone away. So the situation fundamentally is no different than it was in February. So instead of 100% of Americans susceptible, now 95% of Americans are susceptible. So the virus is still out there, and we just do need to be cautious as we go back out and again. So yes, we can reopen America, but we do need to reopen it safely. And it is important to follow the guidelines. It is important to make sure that we personally take the steps to stay protected, and that the businesses or the houses of worship that we go to take the appropriate measures to make sure that they protect the congregants who show up and they protect the people who are working within those facilities. So I saw that note about, can we go back to business as usual? And, you know, trust me, I want to go back as much as anybody to business as usual, but as long as there's a potential for infection out there and the significant chance of death, it's not going to be business as usual.
So, Dr. Khan, we spoke about this question, and I was kind of leaving it for
singing.
One of
yes,
the last is singing.
No singing. No singing.
Can you explain why?
The data is pretty clear. We've now had multiple outbreaks. And this was a really nice report that came out really well done. Chorus, 53 people. Seattle, 2.5 hours together. 43 of the 53 43 of the 53 or 56 were all infected. Over a 2.5 period singing together, one person super spreading event. When you're singing, we know you're expelling air out there for 12 to 14 minutes. It's lingering out there. So there's a lot of now evidence out there that your singing is not a good idea, especially if you're infected. So our suggestion, and everything you read, it's all about taped music or potentially music on an instrument, but singing is discouraged currently.
What about with masks?
Even with masks would be my suggestion for now.
Thank you. So I want to be respectful of time. One of the things I've learned in my Zoom experience of the last several weeks is soft start, hard finish. So it's important to finish up and respect your time. I'd like to thank all of our contributors for taking time and sharing where you are on this path. With great gratitude to all who are serving our community and to all of you who are holding us up in terms of our spirits and our spiritual wellness. It's hard work. And so we really, really appreciate all that is going on. My hope in bringing all of you together today is that today is the beginning of this conversation between us as faith leaders in Omaha, as our own collective and with the experts in many different fields. And so these experts today are an example, but our voice is very important in Omaha, and our voice unified is even more important in Omaha. So if you would like to gather together with Dr. Khan and members of the Tri-Faith Initiative to try to put some concrete answers together to be able to share with each other and a broader audience, please send me an email and let me know that you're interested. And if you've appreciated what we've done here today, it would be short-sighted of me to not remind all of you that today is Omaha Gives, and Tri-Faith Initiative is on the list of organizations that is looking to be successful. We hope and pray that all of your congregations are successful in those missions of gathering the funds necessary that we all need right now. And more than anything, thank you for your open hearts and for your passion to serve our community. So thank you for your time today, and please stay in touch.
Thank you.
Thank you, Mayor. Thank you, Dr. Poor.
Thank you, Dr. Khan.
Thank you.
So Lit Mobile just sent me this solar Wi-Fi